And welcome to The Verdict. Mick Cornett with Kent Myers. Glad you're with us today. We're going to meet a very interesting person who's about to take on a very important responsibility in this state.
A very important responsibility and a difficult one. Terri White, who is going to be the new commissioner of the Department of Mental Health and Substance Abuse Services, will be joining us to talk about how Oklahomans are doing in the area of substance abuse and mental health. I think she's got some really interesting things to tell us, some statistics that may give us a little pause and a little worry about just how we are doing, but we can be encouraged, I think, by her assuming this position and taking on this responsibility, that we are in good hands.
It'll be interesting to see her perspectives as she takes over, as Kent says, a very important part of state government and the health situation in the state of Oklahoma. We'll be back to meet Terri White right after this. You're watching The Verdict.
Every day America uses clean-burning natural gas instead of coal or oil is a day of victory for our environment. That's why Chesapeake chose to explore for natural gas exclusively, and we've never looked back. Because natural gas burns twice as clean as oil or coal, and reducing carbon emissions to combat potential global warming is every bit as urgent as cutting our dependence on energy imports. As America's #1 driller of new gas wells, Chesapeake is moving fast to find untapped reserves of natural gas here at home. It's the right fuel for America's economy and the fuel for a clean air future. We just happen to be early to see it so clearly. Chesapeake, natural gas wins the day.
Cox Channel, following your favorite teams all season long.
Hi, this is James Garner.
Hi, this is Reba McEntire.
Hi, this is Johnny Bench.
Hi, I'm Barry Switzer.
Hey, everybody, this is Vince Gill.
Welcome to my home state of Oklahoma,
where we'll be celebrating 100 years of statehood
in 2007.
Our strength is our people, and the 2,100 Oklahomans from the Cox Communications family are proud to be part of Oklahoma's story. Cox and Oklahoma, true partners.
Happy birthday, Oklahoma.
Welcome back to The Verdict. Kent Myers is going to introduce today's guest.
We're very pleased today to have Terri White, the new Commissioner of Mental Health and Substance Abuse Services in Oklahoma, the Department of that, joining us today to talk to us about what's going on in Oklahoma. Terri has a bachelor's and master's degree in social work from the University of Oklahoma. She began working with the agency in 2001. She's now, of course, the commissioner of that agency. She has served in other mental health organizations in both Oklahoma City and Tulsa. This is her first visit to The Verdict. Welcome.
Thank you very much. Thank you for having me.
You are taking over this month in a very important role in charge as the state's mental health leader. What's your background prior to this? Where did you grow up, and how did you get to where you are today?
Absolutely. I graduated high school in Edmond. I'm from Oklahoma. As Kent mentioned, both my undergraduate and my master's degree are in social work. I had a strong goal to be involved in public policy, got involved by working working with the state Senate as a fiscal analyst, did the Health and Human Services budgets, which included the Department of Mental Health and Substance Abuse Services. Went to work for the department when I realized there was a real need there to communicate the needs of the population who were not getting services, and thought it was an excellent place to make a difference in the lives of Oklahomans.
How have you enjoyed your service so far?
I love it. I truly believe the Department of Mental Health and the Substance Abuse Services is the best place to work. If you're interested in helping people and watching families come back together, watching healing happen, I think there's no better place to be than the department.
Tell us a little bit about the department, kind of the size,
Absolutely.
organization, facilities.
Absolutely. We're one of the 5 large state agencies. Our budget approaches about $300 million a year. We employ about 2,200 individuals in the state of Oklahoma, most of whom are doctors, nurses delivering direct patient care out in the communities. We operate residential substance abuse treatment programs, psychiatric inpatient hospitals, most importantly our community-based services, both mental health centers and substance abuse delivery services, treatment services, most of which are delivered through private contracts as well with private individuals.
Let me follow up on that just a minute. Where do you have psychiatric hospitals?
Our largest psychiatric hospital, sort of our only last remaining freestanding psychiatric hospital in the state, is in Norman. It's Griffin Memorial Hospital. But we do have small units scattered throughout the state so people can receive services close to home. In the old days, people might be in a hospital for decades. I mean, back when our statehood started, we had thousands of individuals in psychiatric hospitals. Today, we have a few hundred. Most people with the advancements in science and medication and those things are able to recover in their community, be with their family, work, and all of those things that everyone likes to do, all those things that are important. So hospitals today are very different than they were decades ago. They're really temporary stays, just like any acute care hospital. Sometimes you might be in the hospital because whatever disease you have, you get really sick, but as soon as you're stabilized, you return back to the family, back to the community, and get your care in the community as well.
Is the one central hospital in Norman, is that enough for the entire state? Would you like to see more, or do you think the current pattern for that is appropriate?
It's a tough question. What we really need is more community-based services. With the advancements in science, the advancements in medication, and what we know today compared to what we even knew 15 years ago, people really can recover in the community without ever having to be in the hospital, but we don't have enough of those services available.
Okay. From a national perspective, how is Oklahoma doing in the area of mental health?
It's a double-edged sword. It's exciting at one point, and I'll talk about that in just a second, but the first issue that we have to tackle is that 26% of Oklahomans have a mental illness or an addictive disorder. That is higher than the national average. Of the 26% of Oklahomans who have these diseases, there's 67% who aren't receiving services, either because their insurance doesn't offer the benefit or the public system, unfortunately, has been underfunded for decades. While that's beginning to change, we don't have enough services. We turn away people every day because we're out of resources. So in terms of what's available in the state, the services that we do have are pretty amazing, and we'll talk a little bit about that more, I hope. But we have a lot of people who have these diseases that just don't have access to care, and that's the key to people entering recovery. In terms of children, and that's one of the most important things I think we can talk about, we have 21% of Oklahoma's children have a mental illness or an addictive disorder. Of those children with an addictive disorder, we only have enough resources to treat 5%. If you're a parent looking for help for your child as it relates to a substance abuse issue, it's not available in Oklahoma unless we have an influx of resources. And that's a tough place for parents to be.
Well, to me, the 26% number is startlingly high, and you indicated that's higher than the norm of other states.
Absolutely.
What is the norm in other states, approximately?
Well, when we look at, one of the questions that's been asked to me before is, why would Oklahoma's rate of mental illness be higher than other states? And one of the things I back up and talk about is, well, let's look at our rates of things like heart disease, diabetes, asthma, hypertension. We have the highest rates of all these diseases. Oklahoma typically has not been a healthy state. So it's no surprise to me when we have high rates of diabetes, which is a disease of the pancreas, that we also have high rates of mental illness, which is a disease of the brain. And until we learn how to become a healthier state and provide early intervention services in all of healthcare, we'll continue to see figures like that. The good news is that with the advancements that we have, treatment does work, and we know that. In fact, treatments for the rates of addiction, the relapse rates for addiction are less than the relapse rates for asthma or hypertension, and they're very similar to the relapse rates for diabetes. We know treatment is very successful. It's just a matter of making sure people have access to the care.
I would assume some people have mental issues because of a genetic predisposition to obtain it. Some have life experiences that have led to mental. Are there other areas, and which of those two is the larger of the problem?
Yeah, and it's interesting it's sort of the chicken and the egg question. One of the things we can talk about, for example, is post-traumatic stress disorder, something that we're dealing a lot now with our veterans. We know that as of today, there's about 73,000 veterans coming back from Iraq who have been diagnosed with some form of mental illness. Of those, about 33,000 have been diagnosed with specifically post-traumatic stress disorder. The other diagnosis includes addictions, other types of mental illnesses, and so it's hard to say whether someone may have been genetically predisposed and was put in a very difficult circumstance that maybe exacerbated the issue, or in some cases where the issue itself has caused the disease to develop. And so that they're difficult situations, similar to child abuse. We see high correlations between children who grew up in abusive homes and mental illness, but it's hard to know. And so we approach it, both are equally treatable, equally recoverable. It doesn't make a difference in the treatment, and so that's the standpoint from which we approach it.
Let's talk about resources a little bit available to your department. I am assuming that, of course, we know we have a relatively large population of uninsured Oklahomans, both adults and children. But of the insured Oklahomans, does the typical insurance that the Oklahoman has, the health insurance, cover mental health and substance abuse services if they go to be treated privately?
Right. That's actually a great question. That is one of the real difficulties we're facing in this state, and not just this state, but in this nation. There are many health insurance plans that do not offer that benefit. Under Oklahoma law, they're required what I refer to as partial parity. Certain mental illnesses are required to be covered, but there is no requirement that all mental illnesses are covered, nor is there a requirement that the disease of addiction is covered. There's some national legislation going on. You may have heard about the federal parity law that would require all insurance plans in the nation to offer that coverage. But without that coverage, which really seems almost discriminatory, most insurances cover Parkinson's disease, for example. Parkinson's disease of one part of the brain, yet somehow the diseases of another part of the brain, addiction and mental illness, aren't covered by these insurance plans. And so if these were available to folks, people might have better access to services, but there are definitely Oklahomans with insurance who are going without help.
Terri White is the Commissioner of the Oklahoma Department of Mental Health and Substance Abuse Services. We'll be right back and learn more about this important issue in the state of Oklahoma.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information.
Shining is taking responsibility. At Blue Cross and Blue Shield of Oklahoma, we know managing your health care can be overwhelming, and it's our job to help you meet the challenge. By guiding, supporting, and showing the way, we encourage you to gain control. Because we believe the best tool we can give you is the confidence to take charge. Blue Cross Blue Shield of Oklahoma, shining through.
Okiwani is an Indian name for a place where children play. When we obtained the camp, we found a lot of oil debris left in the woods. We saw a commercial about how the oil and natural gas industry cleans up old oil well sites. We called the OERB, and they agreed to remove tons of concrete and steel. It didn't cost us a thing. Thousands of children have left their footprints on this land. Thanks to the oil and gas industry, they will for a long time to come.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
There's a whole new world online, but it's not always safe for kids. Never give your name, phone, address, or password to anyone you met online, and always keep your personal information private. It's the safe way for kids, right, gang?
Right. Be safe online.
Thanks to Lauren Nelson and Cox, we're working to keep Oklahoma kids safer online. For your free guide, log on now. And if you feel your child has been placed in danger by someone online, notify law enforcement today.
Are you the one looking for an exciting new career? If so, we are the one looking for you. We are Cox Communications, and we are searching for field service representatives. FSRs interact and perform services at our customers' home. Sound like the job for you? Then some of the things you need are a high school diploma and a good driving record. But for complete job description and qualification, go to jobs@cox.com.
Glad you're back with us on The Verdict. We're visiting with Terri White. She is the Commissioner of the Oklahoma Department of Mental Health and Substance Abuse Services. Terri, what's the impact of mental illness on the state of Oklahoma? Is there a way to quantify the issues that we're discussing?
Absolutely. There's several ways to quantify it. One of the things that we know, what the research shows us, is that mental illness and addiction are correlated with high rates of divorce, unemployment, sometimes family violence, unwanted pregnancies, children in the foster care system. When you look at most of the problems we all want to tackle for the state of Oklahoma, things we want to see improvement in, you'll find two common threads actually going through those issues. One is poverty, which is awfully complicated and I don't know the answer to today, but hopefully Oklahoma is working towards that answer. But the second common thread through all of those issues is mental illness and addiction. And if we could tackle mental illness and addiction, knowing that we have the research out there, we know what to do, we just haven't put the resources to it, we could make a huge impact on all those negative social factors that we're all trying to impact. Probably the single biggest one that we struggle with in Oklahoma, more so than any other state in the nation, is what happens in Oklahoma if you have a mental illness or addiction is that you end up incarcerated. Even though most folks have nonviolent offenses, that's where they end up. They end up touching the criminal justice system, which is very expensive, as you might imagine, destroys families. We have mothers who are in the prison system whose children are now in foster care simply because our system, our state failed and didn't have access to services for these individuals. When we look at the Department of Corrections data, approximately 8,350 individuals are there with a severe mental illness. Not a minor depression as we might anticipate people would have for being in prison, but a severe mental illness. That's 1/3 of the inmates today. Of those, nearly 60% are there for a nonviolent offense. When you look at the females, 72% are there for nonviolent offenses. And that's a real failure of our system when I look at it, knowing that what we can offer is more effective and less expensive than prison. When we look at the juvenile system, you can see the patterns starting there. The Office of Juvenile Affairs, for the children that are in their custody, nearly 79% of the kids who are receiving level E out of home care have a substance abuse issue. That's what's happening with those kids. If we could intervene there, we might be able to make a difference before they head to DOC. Nearly 30% of the children in OJA custody need treatment for a mental illness or a severe emotional disturbance, and the resources simply aren't there yet for those services, although we have the science and know how to do it.
Mm-hmm. Well, is part of the answer having day centers where people can go as opposed to having to go to jail to get their meds?
Absolutely. One of the bad news is that, as we mentioned, we haven't had the resources, but we do have pockets of excellence in Oklahoma. I'm going to highlight just a couple programs for you briefly where we've really made a difference, and if we had this available for everyone, I believe we could actually change the face of Oklahoma. The first two programs I want to talk a little bit about are the mental health court program and the drug court program, programs that have been hugely successful. Drug courts are now available in 55 counties in the state of Oklahoma. We are actually the national model for drug courts, which is really exciting because we're often, as we talked about, #1 in bad issues, but when it comes to drug court, we're leading the nation in how to deliver those services. Some of the outcomes we've seen from drug court, some of the side outcomes that we really hadn't anticipated but are very exciting is we've seen a decrease in unemployment of 80% for individuals who are in the drug court program. Not only are they staying clean and sober because it's a partnership between the judiciary and law enforcement as well as treatment where folks have a hammer, and if they don't comply with what's required in the drug court program, they will end up in the prison system. But we see recovery. Not only are we seeing that, but we're seeing people who are employed, We're seeing a 20% increase of individuals whose children are living with them, which means we're not paying for them in the foster care system. And most importantly, I think when we talk about public safety, is drug court making a difference? When you look at someone who's been in the drug court program, we studied over 4 years, the same cohort of individuals. They were rearrested less than 25% of the time. A similar cohort who was on probation, successfully completed probation, they were arrested over almost 40% of the time. And the most startling to me is individuals who served their entire prison sentence and were released were rearrested over 50% of the time. So in terms of making a difference in future crime and public safety, the most successful program by far is the drug court program, which is really exciting that in Oklahoma we're leading the nation in that. Some of the other programs that we have, mental health courts, which are a newer program. Drug courts have been around since the late 90s. Mental health courts are pretty recent in Oklahoma. We're seeing the same success. Mayor, you probably know in Oklahoma County, that program over the last 3 years, we've seen a decrease in unemployment for those individuals of almost 90% and a decrease in rearrest of almost 90%. Its outcomes are looking even better than the drug court program, so those are pretty exciting. The last program I want to mention in terms of really making a difference in terms of the jail population is another modeled by Oklahoma County. It's called the Day Reporting Program. All these programs are for individuals with nonviolent offenses who have a mental illness or addictive disorder. And in the Day Reporting Program, what happens is that they check in every single day, but they are expected to be at work, they're expected to be taking care of their families. We've seen, the outcomes from that program are just as amazing. Again, unemployments have gone down by 90% for that population. We've seen decrease in days spent in jail as well as rearrests of almost 95%. And probably the most amazing about the Day Reporting Program is in the last 2 years that it's been in existence, it's saved Oklahoma County through the jail system over $1 million for that population. It's much more effective and less expensive.
Let me ask you a question about the Day Reporting Program.
Absolutely.
Who administers it?
It's a combination. It's administered by the county along with the treatment professionals through which we contract.
Well, who within the county? I mean, is it the Sheriff's Department, the district attorney, or who?
Yes, the sheriff's involved, the district attorney's involved, the county commissioners are involved. It's really, the amazing thing about these programs is that it really brings everybody together as a partnership and a team so that you have the law enforcement perspective, the judiciary, the treatment professionals, everybody working together to make sure that individuals have the services they need to be successful, but are also held accountable. And that's why I think these programs are so amazing. And one of the reasons why I think Oklahoma is leading the nation in those alternatives.
What are the barriers that are in place today that are keeping people from receiving the help that they need?
You know, I think that's a great question. If we talk about the barriers, I think the single biggest barrier we face as it relates to mental illness and addiction is the stigma. People are still not comfortable talking about these diseases. If you think 20 years ago, you might think back to your mother or your grandmother, people used to whisper, "She has cancer." And they would whisper, "She has cancer." It wasn't something we talked about. Well, today, we might say, you know, my sister's in chemotherapy, things are going really well, everyone's comfortable talking about it. How often do you hear people actually say, well, my sister has schizophrenia but is recovering well? People whisper about mental illness still. They're embarrassed to talk about addiction. And until we change the stigma that surrounds these diseases, from centuries ago, Mystique, and when we didn't have treatment and people didn't know and people unfortunately lived in asylums and weren't getting better, I think that's where that stigma comes from. And until we break through that and see today, there are individuals in our community everywhere that are in recovery. There are people we know, people we love, who have jobs, who are taking care of their families, who are going to school, who happen to have these disorders as well, just like diabetes or asthma or cancer. Until we feel comfortable talking about it, people are going to be embarrassed, people are not going to seek help, and it's not going to be a priority for public funding or for insurance companies or any of those things. And until we all speak out as citizens and say, it doesn't matter that you have disease of this part of your brain versus this part. These are diseases. They are just as treatable as any other disease, and it's important we embrace these as part of health care, just like any other disease. We're really going to have struggles in the state.
I can't believe how quickly the time on this show has sped by. We are out of time. But Terri, thank you so much for coming on, and congratulations on your new position. We look forward to having you back on The Verdict and seeing all the success that we anticipate down the line.
Thank you very much.
Appreciate it.
Appreciate it.
Kent now have a final word after this.
The good life comes naturally to Tulsa, where nature's beauty is matched with an eye for aesthetics. A legacy of neighborhoods graced with lawns and landscaping and handsome homes. a place that seems to have patented an ideal lifestyle. Bank First is loyal to the quality of life Tulsa assures its citizens, to the priority placed on education, culture, and growth. Loyal to builders who transform raw land into residential charm. Developers who see opportunity and add vitality to Tulsa's economy. Bank First serves both enterprise and private lives that need a loyal partner. It's how we help nurture this city's very good life. Bank First. Loyal to Oklahoma. Loyal to you.
Our pledge as a company is to provide quality of service for our paying customers.
When you illegally hook up cable,
everyone pays.
Theft of cable can cause outages.
Sometimes poor reception.
we seek out illegal use.
And we prosecute offenders.
If you know someone not paying for service,
call us at 1-800-466-5590.
You could remain anonymous.
Cable theft. It's more serious than you think. It's a crime.
There's a whole new world online, but it's not always safe for kids. Never agree to meet anyone you only know online, because they might not be who they say they are. And if you must meet them, take a parent along. It's the safe way for kids. Right, gang?
Right. Be safe online.
Thanks to Lauren Nelson and Cox, we're working to keep Oklahoma kids safer online. For your free guide, log on now. And if you feel your child has been placed in danger by someone online, notify law enforcement today.
Back to wrap up a show on the verdict. Mick Cornett and Kent Myers, and we were visiting with Terri White. She is the new Commissioner of Mental Health for the state of Oklahoma. Very impressive and I think an effective advocate for her issues.
Well, absolutely a great advocate and one facing enormous problems. And I can't imagine someone taking on those problems without a lot of enthusiasm, a lot of intelligence and background and an ability to do something about them. She certainly has those attributes, and I think we're going to have her back here in 60, 90 days and get a little update on what's going on and how she's doing. And the one thing that she mentioned that I've wondered about and didn't get a chance to ask her because we ran out of time, but it's basically the stigma attached to reporting mental illness. You fill out a job application, one of the questions is, have you ever been diagnosed, and so on and so on. I'll be interested to see how she goes about trying to lower the stigma level of reporting mental illness.
I think she has an opportunity to succeed because there's growing awareness of the issue. There's growing awareness that we underfund the issue. Yeah. And so I think, you know, not that we haven't had the right people in place before, but I think she's another well-qualified person and can kind of take the momentum that's already building and move us forward. There's certainly room for improvement in the state of Oklahoma. Well, glad you joined us today and glad you got a chance to meet Terri White. We hope to have her back on a future show. And next week, Kent and I'll be back with another edition of The Verdict. We'll see you then.
The preceding program was produced by the Production Services Group at Cox Communications, exclusively for the Cox Channel.